Oh, there we go.
Let's see. Hello, everybody. Welcome to Canada Talk with Roz and my co-host Eric Range. Happy Friday. We have been away for a little bit of time, and I'm so happy to be back. Sometimes we got to take a little pause for the calls and kind of get ourselves together, and just with between so many different activities that were going on regarding webinars and participating. The schedule just got crazy. But today we have an awesome show. I'm so excited to have our guest on for today. Um, so without further ado, Eric Range, how are you,
What's
my
up,
friend?
sis? What's going on, sis, man? It's always
What's
good to
going on?
see you.
All right.
People, I hope y'all understand we do try to get here every Friday when we can, but we do also run businesses and have families and stuff. So we wear a lot of hats, and we're always working. We're never not working, as I say it. So bear with us. We'll always come back to you. We thank you guys for sticking around, and whenever we're not here, go check out some of the episodes we've done in the past, man. We've had some amazing guests over the wow, it's been years now. I can say that over the years we've had some amazing guests on Canada Talk, and so I'm glad to be back as well. I'm glad for our guest today, man. I think we're gonna have an exciting conversation. Always keeping that focus on our health and the health of our selves as individuals and the health of our community. So I'm just excited for our conversation today.
All right. So listen, we got April. Hold on. We got April Hatch. She's coming in. But while April's coming in, let me just tell you what the show is about today. We have to be so just looking at legalization and what's going on throughout the country. One thing that has really stick out in my mind that I'm concerned about, that I want more emphasis on, is our medical programs that we have. We have a lot of a proliferation of states that are looking to go adult use, and I get it and I support it. But I want to make sure that we always look at the medical side of this plant and the efficacy and the education. And so with that being said, hey, April.
Hi.
So with that being said, we have two phenomenal ladies on, two women on today who are going to share with you from their perspective, what does it mean when we talk about cannabis, community, and policy? And so my first guest, I want to introduce Ms. Kebra Smith-Bolden. Kebra, hi, my love. Please introduce yourself to everyone. Tell them where you're located and tell them a little bit about what you do currently in the industry.
Okay, my name is Kebra Smith-Bolden. I'm a registered nurse and a cannabis nurse, and I started studying cannabis soon after my grandmother was struck with an aneurysm, and we medicated her with cannabis, and I saw such a complete turnaround. And after being a nurse for over a decade at that point, I had never seen, such improvements in such a short amount of time. And so, and excuse me, like I'm stuck in bed with my leg up, and like I just text my daughter, like, you put me some Kleenex, and my nose is like running. I apologize. I started studying the plant, learned about the science of the plant, learned about the medical benefits of cannabis, and really wanted to be a part of making sure that my community was educated about the benefits of the plant. Also, to talk to them about business opportunities in this industry. As a nurse, we are one of the most trusted professionals in the world. And so, people come to us for things other than healthcare often. So to be able to talk to people on both a psycho, social, medical, financial benefit of cannabis in their communities or in their personal lives has really been a great thing for me. And about we're about 4 years in. I began Canna Health, and we are medical cannabis certifying centers. We have 6 in Connecticut, and now we're outside of Connecticut, in the states of Pennsylvania, Georgia, Maryland, and DC. And so we have expanded by offering, similar to a franchise, but a licensing model in which people are able to become owners in this industry and own a Canna Health, and really be able to affect change in their communities and give people access to safe plant-based medical cannabis.
Man, that's so awesome. I remember when Kebra first got started. Kebra used to be with M4MM. She used to be our Connecticut chapter president. And that was when it was just, it was probably Roz and Eric running around looking crazy. And she was like, listen, I'll help out. And we have always, and she doesn't serve in that role anymore, but have always stayed connected. And I've been super proud of the work that she's done. It is so clear and evident, guys, that we have communities that are still not understanding the efficacy of this plant and understanding how to access it and to do it in a safe way. And that's these ladies are clinicians, they're healthcare practitioners who really have now transitioned their skill set over to the cannabis industry. And that's a great segue. April Hatch, my sister, you are my sister. We were up late last night and we just made the connection, and she's on the show. Thank you for gracing us today. Please introduce yourself to everyone. Tell them what you do, where you are, and a little bit about, you know, what you do in the space. Hold on one second. I'm sorry. There you go. You got it.
All right. Thank you so much for having me. It's an honor to be on the show. I have a similar story to Kibra's. It was actually my son who needed cannabis after traditional medical treatment failed, after 2 years. And so just knowing what I had to go through to truly understand the plant and the dosing and the delivery method and the cannabinoids, I mean, it honestly took a great deal of research and time just to understand how best to administer it to him. And so it was I was new. I was introduced to the medical aspect of it, and I wanted to make sure that other people didn't feel as overwhelmed as I did. So I started in Kansas City, and I started educating primarily patients. And our mission is to provide the education, support, and advocacy that patients need. However, we've seen that our services can be utilized in the industry as well. And I apologize. I'm in a hotel lobby. Can you hear that? So so I'm in Missouri, and I see patients talk to patients all over the country. COVID really hit everyone hard, but it really honestly gave me the opportunity to make sure that I was able to do everything online. So that's a little bit about what I do. But education before medication is really what I preach. So many people who've been consuming cannabis for a long time still don't know how to get the full medical benefits of the cannabinoids and the terpenes of that plant. And so I want to teach those people as well, not just new people.
Absolutely. If I could ask a quick question to both of you guys, because I think you guys both play such a vital role in this industry. When we talk about aging populations, when we talk about who we are seeing as the fastest patient population, many of them may have tried, cannabis in the past a long time ago, which we know the cannabis of today is not what it was back then. And then, even more have never tried it. And it can be very overwhelming if you're either trying to source it or understand it for your aging parent or grandparent, or even harder if you're trying to figure out how to do it for your kids. So talk about how you guys are helping to and I apologize, my little one's in the back right now. I don't know if you guys can hear him, but talk about how you guys are helping to ease even the anxiety of approaching this subject, for so many people who may not otherwise come here without folks like yourself.
That's a great question. So I think that it's important to start with evidence-based information. There's a lot of information out there on the internet that is truly just misinformation and isn't really appropriate for somebody that's brand new, just getting started. So just finding a good resource for information is as number one. And then I think and this is what I try to do with all of my patients, is I want them to understand the endocannabinoid system. I want them to understand how that affects other systems of theirs. And I think once they have that understanding, not only can they consider cannabis for treatment, but maybe they start to make other lifestyle changes that will help promote the health of their endocannabinoid system. So I would say for me, those are two places where I think patients should start.
Absolutely.
And then in our communities, especially communities of color, inner city communities, we've been inundated and bombarded with false information, with propaganda, with criminalization, with so many things that it's really almost, I mean, it's vital to like unpack some of that stuff first. So, not only are we having to start from the absolute very beginning with cannabis is not a big gateway drug, like, because that's where we're starting. I'm not able to start with the endocannabinoid system.
Yeah.
I can start with cannabis. And no, they are not going to come kicking your door
Yeah.
because you are, utilizing cannabis. And these are your protections that you have within your federal housing. Or, there's so many things that we have to talk about first in our communities because it tends to, the use of cannabis has been used to torture and to destroy and to tear down our communities. And so, I'm finding that the older community, they are interested in plant-based medicine. They are interested in any alternative to opioids because they're really afraid of it. But there are still those, the effects of the stigmatization for decades, hundreds now of years almost, where, they really, we have to start from the absolute very beginning. So
both of you ladies are in states where there's a medical program. What are some of the pluses of the program that you like, and then what are some of the things that are challenges from a healthcare perspective when you see patients or potential patients that still challenge you to this day?
I know in Connecticut, one of the challenges, one of the positives, in a way, sort of, we have a pharmaceutical model here. So instead of a traditional dispensary with bud tenders, we actually have pharmacists and pharmacy techs who actually administer and distribute the cannabis at dispensaries. And so that there are benefits to that because they're able to look at the chemistry of the things that you are on and how things interact and make recommendations based on the findings or the most general findings or symptom management that that cannabis can offer. And so, it adds a little extra bit of science, a little extra bit of, medicine, and when they're making recommendations. And that's a support that patients in Connecticut have from the very beginning. I tell people a lot of times when they come to me to get certified, when I first started Canna Health, we used to have these long consultations, and I would bombard these people with all this information. And these are all the different strains, and this is what a terpene is, and this is what the cannabinoid, and this is the endocannabinoid. I would give them all these things, and they would either leave it there on the table,
It was too much. It's too much.
It was too much. I mean, oftentimes at Canna Health, we diagnose people with PTSD. And so, a lot of people are coming there and realizing that they really truly have trauma, especially from urban communities. And
Yes.
so we're already like opening up a huge wound that they had, and talking about traumatic events and then saying, yes, you are. And of course, making recommendations for treatment like therapy, etc. But by the time we get through all of that, the last thing anybody can retain is information about the endocannabinoid system.
Yes.
So it's good that as they transition and they obtain their card, that they do encounter a medical professional that can really help guide them in Connecticut. So those are the positives.
How much is your card in Connecticut, Kira?
So so the price range is anywhere between up to $350. I've seen practitioners charging. I don't do that, of course. We keep our prices really low. Like we have built-in discounts for people who are receiving any kind of federal assistance, any veterans, any essential workers. We just added. So our lowest rate that we charge right now is $100 to $125.
How much is the card? How much does Connecticut charge for the card?
The state charges $100.
Oh, okay.
So there have been legislation put forth in not this last legislative session, because they ain't talking about nothing in this one.
Sure.
Because of COVID, but in a previous legislative session to that one, they had proposed to eliminate the fee or reduce it significantly, like to $25 for patients. And that's something that I've been advocating for. Because in addition to being a business owner and being a nurse who still works in the community, I also do a lot of advocating for not only patients, but again, for communities to benefit from legalization.
No, I love it. April, same question, because I know Missouri, just even on a high note, their charge for a card is only $25. So
Right.
So for the state that you're in right now, what are some of the high notes that you think that's a plus? But what are some of the challenges that you're seeing? And you're a brand new state that's still trying to get it going.
Yeah, so the challenges in Missouri, I mean, number one, the fact that patients don't have access to any open dispensaries right now. We're anticipating still. So we're anticipating dispensaries opening within the next couple weeks. However, they're only going to have flower, and the limited supply from maybe 3 cultivation facilities. I mean, these prices are going to be unaffordable for most people. And of course, there's going to be such a limit on how much people can purchase. And I do work a lot with patients in Oklahoma, and it's really the exact opposite. But what we did a little bit differently in Missouri than what Oklahoma did is it seems like they required a lot more education from the dispensary to the patient. And so that's why I'm really needed so much in Oklahoma, because there isn't that educational requirement. People just walk in the door and they're so overwhelmed, and they honestly end up purchasing products that may not be the best for them. They try it and then they call me, and and sometimes they're not even willing to try it again. But so I think Missouri in a couple years will look back out of the program, but right now patients really only have 2 options. That's to go get a temporary card and go somewhere else, or I mean, most people honestly can't afford to cultivate at home. Most of the people I come across, they don't even know what strain would work best for them. They're very new to cannabis. So like investing $1,000 in grow equipment is just out of the question. So that's my biggest concern with Missouri is going to be the cost.
You know, that leads me to a question in regards to, when you see, in particular in communities of color, like to here in Florida, just to get into the program, when we started off where you had to have a $90, or 90-day visit with your doctor, and pay co-pays and all the, I mean, those are things that we know automatically become prohibitive for many communities. Mm-hmm. And when you talk about lack of access, when you talk about supply issues and so on, I know none of us on here are trying to push people to the black market, but what do you tell that patient who is in need and it cannot find those, let's say, safe access to the plant? And when I say safe, I mean through the legal programs, not that all legal manufacturers and growers are doing, have safe practices, but just saying safe to where at the very minimum, they're not at increased risk of being arrested or, come into any type of harm. But, what do you say to that, to those type of patients?
So I always make sure that patient has their card. So if they are, come in contact with any, the police or anyone, that they have that card and they can prove that they're a patient. I really hate to say this live, but Kibra, you probably know, but when you're in a state and there's no access to medical marijuana, and like yesterday, a wife of a pancreatic cancer patient calls me, I'm going to tell her, honestly, to do 2 things. I'm going to tell her to start talking to her friends, and I'm going to tell her to potentially consider going to another state to get a temporary card and get what they need down there. And that's just what we have to do at this point, because we got to find a way to help people.
Yeah. I will say this, April, tell them just a couple of states over, Oklahoma, what the difference between a state like Missouri and Connecticut, and then you can have a state that's in abundance but don't have the right education for folks. Tell them the numbers in Oklahoma, and you were just there.
Yeah. So there's 2,500 licensed dispensaries. There's over 9,000 licensees total, labs, cultivation. I mean, that's more than like all of the other states have combined, right? And so there's a dispensary on every corner, and it's patients are like so overwhelmed with just that. They're like, which one do I go to? You know, because there's like 6 within walking distance from them. And then I hear a lot from industry people that they can't find bud tenders that know the difference between like a sativa and an indica. And I'm thinking, well, that shouldn't even be the qualifying factor for hiring someone because it's so much more than indica and sativa.
Right.
So they're having a hard time finding people who have the knowledge that, I mean, patients need from their bud tender. And it's, you know, in a study that I've read, I think 94% of bud tenders provide specific medical advice. And when they don't have the knowledge themselves, that, you know, that could be dangerous for patients. Not, I mean, generally cannabis is a very safe plant. Don't want to say
Yes.
dangerous, but it can leave patients uncomfortable for a little bit, you know.
And if a patient is already immunocompromised and, things aren't stored properly, or, they interact with some sort of not legal pest,
Yeah.
anything, heavy metals, whatever, it could really put someone in danger. So although I do, the legacy market definitely laid the path for us and has been medicating our communities for decades, and I am all for supporting them. I probably shouldn't say that live either. However, I do encourage my patients.
We have a disclaimer at Canna Talk with Roz. We just let y'all allow y'all to talk and share.
You know,
And
we have real talk.
I try to tell. But the reality of it is, and especially people of color, we have to be so careful. Literally, my son is 22, has a medical issue or what have you that is appropriate for a card. And instead of him, like I was like, listen, you need to, if you are going to utilize or even think about it, let's get your card. Mm-hmm. And I will say, if it were not, and he had a not so good experience walking into a recommending physician office where they were just kind of like, oh, you don't have this paperwork, you got to come back, and blew him off. Till his mother made a phone call and was like, what's going on? And then it changed. And that should not be the way. And so I guess my question for both of you ladies, what are you doing, or what are some of the recommendations that you have for the healthcare community? There's a lot of folks in the healthcare community, physicians, DOs, chiropractors, nurses, nurse practitioners, medical assistants who still have no idea. What do we do to bring them on board or get them engaged more so in talking about this plant as an option? And what things have you done?
Yeah, I teach at our local community college, and I'm not teaching in the nursing program as of yet. There are plans to add a section on cannabis in the endocannabinoid system. So hopefully we'll be putting that together soon. But I teach like the what we have in New Haven called oh God, what are they called? Like health finders. I forget what they're called, but they literally connect people in the community to services. Okay. So I teach them. They're like pathway. I can't think of what they're called, but I teach them about cannabis. I teach them about the medical program, and so they're able to make recommendations. And I go to churches and I educate people, so it's just a matter of just beginning. Now, I can't do everything and be everywhere. We teach classes, we're trying to empower the community to help them be knowledgeable, to share that information. And so those are the ways in which that I'm being and doing, having interviews like this, having conversations like this. This is what's really helping the community to understand better what this plan is all about and how it can help.
Absolutely. April, your thoughts?
Yeah, I would definitely agree. I have a little bit of a different opinion. I have found it very difficult to get in and talk to physicians and nurses and hospitals and long-term care facilities because cannabis is federally illegal. They won't have anything to do with it. So I feel like, if it was descheduled and medical programs were required to talk about the endocannabinoid system as well as nursing programs, that it would be different. That they would have more of an open mind if we could get it descheduled, because it's difficult, and it's scary for the physicians. I mean, they're worried. They prescribe 15 different medications to this patient, and they're worried that cannabis has some interaction with something, that they're going to lose their license or face a lawsuit. So I totally understand that, but most of them just won't touch it because of the federal because it's federally illegal.
Wow. And you know what? And I think your point in regards to like, I know you have a commitment or a passion or interest in the hospice and end of life care. And I don't know if you know, I spent 8 years in end of life care. And so those patients really could really utilize this plant from another option of care. And it's because that Medicare benefit is the hospice benefit is paid 100% by Medicare, and they just won't touch it. And I think it's a travesty.
But I work in hospice currently too. That's interesting that we all. I do hospice. I'm an on-call hospice nurse. Every other every other month. So anyway, what we have found is that there are people who are choosing cannabis. Like, I openly talk about cannabis with our patients. We just can't put it on their med profile. But the conversation, we're talking about it now. It's still federal legal. We're on a national World Wide Web. Like, a conversation is a conversation. And like, sometimes for my patients, I will bully my way into a doctor's office. They'd be like, "No, you need to talk to me. Or go with a patient to an appointment." If it has come to that, and it's something, because some things are, we really want to work with doctors and physicians and make sure that those interactions aren't, going to be dangerous to our patients, and making sure that, before we taper them off of something and titrate them onto something, that we are working in collaboration with their physicians. So sometimes, even if they don't want to have that conversation, either that patient needs to find a whole nother doctor, because that's really what it can come down to, or we as professionals may need to support them through having these conversations and really like pushing forward with this, because despite federal illegality in our states that have medical programs, they are not acting, in error to recommend these services for our patients.
Yeah.
Hey, Keeper, I want to touch on something that you kind of talked about in your intro, and your business model, in terms of how you are helping other people start businesses in this space. You can only be in so many places at one time, but you've created a model that people can pick up and take to their states and so on. Talk about what led you to do that, and why you're doing it, and any of the benefits you think you're seeing from that.
Well, I'm sorry.
Go ahead.
It was for Keeper first, and then
okay, cool.
You can follow up with that. I mean, because I think it's such an important part that you guys are, you're helping patients, but you're creating, a way of making money for yourselves and for your families and so on, and your communities as well. So you can both touch on it. But Keeper, go ahead, go first.
Sure. From the very beginning, when I was trying to find my professional and a business space in cannabis in this industry, I got to be honest, it wasn't hard. I had become a part of Women Grow, become a part of Minorities for Medical Marijuana, and just being engaged in those conversations, in those environments, being able to interact with people made it kind of easy for me. They were like, "You're a nurse. Why don't you do something as a nurse? Why don't you?" And I was like, "You know what? You're right." And so, that's kind of how Canna Health was developed, because I was like, I'm a nurse. I want to educate people. I want to give people access. And then, because it happens so kind of like naturally for me, I was like, you know what? I want to be able to help others get in this industry, because people who look like me don't have millions of dollars often in the bank. They don't have people who will guarantee funds for them to open up dispensaries and grow facilities. So this was a way for people to obtain experience in the industry, because that's what they're asking for on these applications now, which I think is so strange. Like, how are we going to have experience in an industry that is
That's
like
so brand new.
yeah, so brand new. But this is a way, and this was an opportunity for people to really affect change in their community. So I tried to perfect the model with my little limited skills, y'all. It's been a struggle, but I tried to perfect the model so that it could be easily replicated. And we've been successful at that. And so now we have 6 licensees who are operating independently. I recently created a medical record system specific to Canna Health and cannabis in general, so we can market it to other medical cannabis certifying centers or medical cannabis educators to be able.
Let me stop right quick. Do you pull demographic like racial, like things like that? Yay!
Because and it's into our analytics have that specifically. When I created the system, one thing was very important to me, because I feel in my spirit that the information that we are able to obtain from doing the PTSD, the post-traumatic stress evaluations and assessments, is going to be useful, in determining things such as, reparations. Really being able to look at the number of people from communities that have been affected by the war on drugs, the number of traumas they've experienced, the amount of time or loss or whatever that they've been missing from their communities. That is the type of information that we're going to be able to garner from this system. So it's more, that was like my sneak thing. You just told it.
I was gonna say,
I love it.
I caught that. I asked you about the franchises, and you coming with technology platforms, but this is the beautiful thing about the people in this space, man. We are creators, and we're creating the tools and the resources that the industry needs. And so I'm excited to hear about that. I'm excited to watch all of that.
Yeah.
April, tell us a little bit, about your business model as well.
Well, so honestly, before, what I was going to say is Kibra is really such an inspiration to nurses like myself and others. Really, we're just trying to build a solid foundation. And I have so many nurses contact me in new states. Somebody contacted me this morning from Idaho. And, it's just wonderful that I have had mentors like Kibra, and that now hopefully I can be a mentor, to someone else. So absolutely, it's all about creating opportunity. And Kibra, thank you so much for the opportunities you've created. And that's really all I'll have to say. I mean, my business model.
This is why we have to talk with Roz.
Thank you.
Hey, so listen, there's a question there. So we have Lola Cassidy. Hey, Lola, nice to see you. Does the panel support a mandated COA requirement?
So I would say that I want my patients to consume something that has a certificate of analysis attached to it. And I think that it's important for patients to not only ensure that they're consuming safe quality medicine, but I think that when they're trying to figure out what's going to work best for them to know that terpene profile and those cannabinoids that may be present, it's a good idea just to have that.
Right.
For personal use.
I mean, I think it could be prohibitive. I think it could be like really costly, and because corporations can do it, like the big ones, but like I think smaller businesses will have difficulty meeting a lot of those standards. But that is not like impossible. But there will have to be support put in place, because we have a lot of people who are in equity programs and who are like barely able to like make it. And so if we add a lot of extra requirements, that could make it very hard for them to have sustainable businesses. So if we do mandate those kind of requirements, then I think there should be provisions in place to support smaller businesses and to make sure that they're able to meet those requirements.
I want to get you guys' thoughts on something in terms of like the future of cannabis healthcare, if you will, right? Mm-hmm. Because touching on this same topic of COAs give patients or businesses who are buying these products, the state governments and so on, it gives them a way to know what's in the plant, set different parameters on the harmful things that we allow in the plant and so on. But we don't do that for any other medication, right? You know, we put that in the hands of the doctors and the pharmacists.
And this happens to be much safer than almost everything.
Right.
Everything else. Yeah.
So
that part.
You're kind of seeing where I'm going with this.
Yep.
So I think
that's why I feel how I feel.
You know, long term, where do you guys see this industry? I personally believe that we'll see, you know, someone asked a question earlier about should we have training programs for like bud tenders and those type of people so that they can get better medical information to share with the patient, you know, at that point of purchase. Or should this be closer to, you know, the pharmaceutical model where you have pharmacists who have gone to school for, you know, pharmacology, who understand drug interactions, who understand these things that doctors are worried about. So I'm curious you guys' take on that.
Thank you. I want to take that one first. So what I would like to see for the future of cannabis medicine is I want to see everybody have at least one plant growing in their house or in their backyard. I think that not only growing your own medicine provides so many benefits, but to truly ensure that you know what's going into that plant, you know, you're the one who needs to raise and nurture that plant. And so that's really what I see, because even with dispensaries, the access can still be very prohibitive. I mean, just the cost alone. So that's where I would like to see cannabis medicine go. You know, if it's different co-ops that form, if patients can't grow it themselves, that's what I hope to see in the next 5-10 years.
Yeah. Hey, this is a quick, like, kind of inquisitive question. Do you ladies have a preference in regards to delivery system of cannabis? Like, are you a flower person? Are you a tincture? Are you a topical? Like, you know, Kibra, what's your, like, do you have a preference? Or not, I shouldn't say a preference. It depends on the condition, but it's something that you really like.
Y'all know I'm from the hood. I like
Hey, what you say, Kibra? Keep it real. Don't get it twisted, right?
I like flat and a blunt. But like as far as my patients go, of course, like we take many things into consideration. So like even now, if I had the knowledge that I have now, when I was medicating my grandmother who had an aneurysm, she would not be smoking anything, you know. And so being able to understand like what other things are going on in a patient's life or healthcare, whatever, that would help to guide the way in which they should medicate. But that's the one thing I love about cannabis. I say all the time, because you could be completely autonomous. Like you might want to, smoke a bowl in the morning, take a capsule at night, rub some, THC salve on your aching arthritic knees, take a bath in some bath salt. Like there's so many ways to medicate that, I really encourage patients to journal. So try things, write it down. Oh, this capsule had too much, or this, inhalation, but all that stuff is very important. And so I think although it could be costly, I often tell patients like try a little bit of a few different ways and see how you feel about it, and then make a decision from there. But yeah, I'm a blunt in the.
What about you, April?
So when it comes to my patients, in the beginning, I always ask, if they are brand new to cannabis, they probably thought about how they want to consume it. Their friends are probably consume it. I mean, and still the majority of them want to smoke it. And I absolutely get that. There are so many different delivery methods, like Kibra said. I mean, head to toe. I mean, everything that you put in your mouth or to put on your skin can include cannabis these days.
Yeah.
Personally, for me, it's like a combination of things. And I'm so glad that you brought up the bath salts, because smoking a blunt in the bathtub with THC bath salts is like, true medicine.
Can I just tell y'all that I just traveled and I had freaking bath salts in my pocketbook. Like, and of course, TSA is like, what's this? It held up my whole flight because it's a bath salt. But I'm serious about that.
It works.
It does.
and I will say this, ladies, and we would be remiss if we didn't bring up that we are still in a pandemic, right? And the the stress, anxiety that's going on in this pandemic is real, and
Yes.
we should be talking about, especially in those states that have anxiety as a medical condition that can be appropriate, like how important it is to talk about the fact that, especially communities of color that are dying. I mean, like literally, people are scared to go outside and they have stress and anxiety because of this. How important is it to have conversation about this as an option? Not necessarily to get high. There's a you can do everything in moderation, and I want you guys to talk from a clinician perspective of how you have that conversation about doing it in moderation, but to get you the relief that you need.
Mm-hmm. You want to go first?
Yeah. So, in the beginning of COVID, I had very few people reaching out for help and for education. And I do work with some physicians who do the certifications. And then I would say 2 or 3 weeks into it, everything just spiked. I mean, the levels of depression and anxiety. I mean, people had lost their jobs, people were at home with their kids. I mean, it absolutely crazy. And what I've noticed now is that, people are continuing to experience this long-term depression and anxiety of how they've been affected by this pandemic. And now they can't afford to even get a medical card because they've been off work or they're scared for the future. And so it's been very difficult for during this pandemic when it comes to patients. I always tell patients it's absolutely possible to heal without getting high. You don't have to feel any psychoactive effects from THC in order to receive the medical benefits of this plant. I mean, there are so many cannabinoids that don't cause psychoactivity that can help improve so many conditions. So it's really up to the patient. Do they want that additional those intoxicating effects? And absolutely, I think that's totally acceptable if they do. But if they don't, there's absolutely options for them.
Absolutely. Keep your thoughts.
I teach, my seniors to start low and slow, to really make sure that their body, they're allowing themselves to adjust. Everybody has a different experience with cannabis, but I think that's really, really important. And I had another one, but
that's the most important one. Start low and go slow.
Hey, I got a question for you guys. This is from Lola again. Does your advocacy extend in supporting medical marijuana patients who live in HUD housing to avoid eviction and exclusion? And yes, Lola, for sure. But I would love to get from Kibra, that's a big head nod. Talk about the importance. I mean, that is whole. If you guys don't understand, there's a group of people that they go to work, take care of themselves, that could be suffering from a medical issue, who cannot legally, in some instances, be able to access cannabis as an option because it's still federally illegal. So, Kibra, you go.
So definitely, that's part of, I always say, like, yes, I'm in healthcare and medical cannabis and all that, but I really feel like that Canna Health is a bit of social justice and really making sure that people are knowledgeable about their rights, and they're not punished for medicating with a plant. Like, it's ridiculous. And so there are in almost every medical state, there are provisions of protection for individuals who have medical cannabis cards, and it does extend to federal housing, to the extent that that you have those state protections. So you're able to utilize that as a means of not being evicted. I will not say that you will not. You could still be harassed. And unfortunately, a lot of us don't have the legal option to fight harassment like that. Like I've had people who call me and they're like, landlords are really giving them a hard time. And so, if they're able to legally kind of pursue that outside of housing court and just deal with that portion of it, then I encourage them to do so. But, there are protections and provisions, and there are people who will support and make sure that you are not discriminated against, and quickly. And there's precedents being, precedent cases being formed all around the country, including Connecticut. We already, a couple years ago, we had the first employment precedent making case where a person was not, was they didn't get any financial compensation, but they were, the employer was deemed responsible for letting this person go despite having a medical cannabis card. So we're starting to see lawsuits that are coming to the forefront that are really setting the tone for precedents throughout the country.
Before you go, April, I just want to make that point, because I'm circling back around, that the whole key of this conversation today is about cannabis, community, and policy. And that policy is one of many that we and everyone that's listening in your state, we got to shore up the medical program policy. We have some programs that have been in existence for the last 3 to 4 years that need some improvement. They need some rider bills. They need some decrease. And one thing is employee protection. I know I've been working with Eric Stevens here in Florida. Shout out Eric Stevens if you're listening. That's so clearly important. So I just want to make that note. Yes, April, please.
Yes, absolutely.
And affordability on that.
And affordability.
Yes.
Affordability. Yeah. Go ahead.
I would agree with everyone. And I was just going to say, Missouri isn't there yet. Most people are honestly, if they're living in HUD housing, or if they have an employment position where they might get tested, they really just need to know how to pass that test at this point. And, just being real, that's just the way it is. They don't want to be the person they don't want to be the example. Because they're just trying to make money. They're trying to put food on the table. They can't afford a long legal battle. So it's just, it's really unfortunate. And we absolutely do need to see those protections in place for people.
It's heartbreaking when you're trying to do the right thing and do it legally, and then having to have something fall back on you. It's heartbreaking. So
and I was gonna say, InfoMM has a legal network, different attorneys that we work with, and we're always looking for more. So if you guys are attorneys out there and so on, this is an area where we hope to be able to support some of those people if they find themselves in those situations. Maybe connect them with an attorney who will provide some level of pro bono service and those type of things, and just support them. So, we can keep that in mind as well. So as an organization, we definitely advocate for that. I'm curious as what you guys do when you're talking to your patients in regards to the food, the nutrition side of the conversation, which, I think oftentimes gets left out, especially when we talk about communities of color without, many are food deserts and those type of things. And someone asked a question in regards to, what do you tell someone who has, a nut allergy and knowing that a lot of processors use MCT oil in order to cut their products with? So, how do you, again, and I think that dovetails, very nicely into the whole conversation about nutrition. So either one of you guys can take that.
I don't talk too much about nut allergies, so I'll let you take that one.
I think that anytime someone can take the flower and make their own medicine at home with whatever way they want to make it, using whatever carrier oil is best, is going to be more cost effective. So that's what I would talk to that person about. And then, with, and I mentioned a little bit earlier, talking to patients in the beginning about their endocannabinoid system and possibly making other lifestyle changes. That's really ultimately up to the patient, and I'm going to help them do that as best as I can. So if they are wanting to make a change to their diet or looking for access to healthier foods, I'm going to help with that. Oftentimes it's, really just making one small change at a time when it comes to that. So just by introducing something new that hopefully they can already find close by. So, they may not have access to fresh green beans, but they may be able to find a bag of frozen green beans nearby.
Sure.
So things like that, I try not to overwhelm them, but, let's just start small, right?
Absolutely. Hey, and April, I did a little research. I know a little bit maybe a little more about Kebra than April, but I see there's some you guys have some I call it passion projects, things that really that are near and dear to your heart. And April, I saw that your stand on cannabis and dementia, and I would love to hear more about your thoughts about that. And Kibra, I would love for you to share a little bit about the project that you did when you were with M4MM that continued on, the urban PTSD, and how important that conversation was for our community and understanding that that's a real phenomenon. And talk about that. I think that event, I wasn't there, but through your eyes, I felt the impact. And if you could just give us a little snippet of the impact of that event, and give them and tell people, give them the overview about what it was and what you did.
Yeah, I believe that there was a lot of violence and a lot of things just happening. Actually, what had happened was a young woman from my community was shot and killed in front of her children in a car, and it really divided our community in a couple of ways. And this is things that people don't think about. Yes, it was absolutely tragic to have lost that woman, but the person who committed the crime was beloved and liked by people in the community too. And people were really struggling with, how to feel about this. And it just had brought up, what I had been researching and what we have been talking about with regarding PTSD and urban trauma, and just the level and the amount of layers to the trauma that exists in communities of color. And so I reached out to Roz and I was like, we really need to do something in my community. People are struggling, they're suffering. We need to have a conversation and really kind of like start shedding some light on trauma in urban communities. Can you help? And, we were able to put together with M4MM sponsorship and a local business owner in the city of New Haven, in which I live. And we had a forum in our city city hall. And we had people who were there just talking about the trauma and what they've experienced. And we were able to support each other. And we had psychiatrists and psychologists and licensed clinical social workers on hand to really address these people as they were, exposing their selves. Sure. And this was really a beautiful experience to be able to be a part of it, because I believe that it was a beginning of healing and change for a lot of people. But it also really sparked a conversation, and people, it created a familiarity with the fact that people have suffered traumas, and that there are, and okay, so I'm not just hypervigilant for no reason. I don't have a hard time, maintaining relationships just because, it's because of the things that I experienced throughout my life that have been normalized, and I've been
child abuse, sexual abuse. I mean,
all the things.
trauma.
Yes. Yeah. I remember my first time speaking at Women Grow, I talked about a young man who had been molested. He had been abused. His mother was a drug addict. He saw his best friend get killed in front of him. He had it was so many things, like maybe 10 things. And so, but this was a local young man. And when he murdered someone, and when the judge was giving him his sentence, he said, "You all failed this kid, though." Everybody was around seeing all this stuff, and
all the breakdown.
And families didn't intervene. So many different people. And so it's important never to justify, because that young man should be punished for taking a life. But It is important to understand what could lead to such a thing so that we can intervene. So one of my passion projects outside of the overall project of urban trauma and PTSD is I am on the juvenile review board. So anyone between the age of 7 and 17 who gets arrested in my community, before they get shot into the system, before they become, get criminal convictions, youth convictions, whatever, they come to us. And so if they're stealing something, we look and see, well, why? We're asking the right questions till we get to the why. Well, you're hungry. That's why you're stealing. How can we connect you to services? And then what do you want to do with yourself? What things do you like? And trying to get them to explore those things so that they have opportunities to not become that young man. And if we intervene as a community early and really start providing alternatives and really supporting these children, we won't have these adults committing these crimes. You know, if we are able to help them get educated, I go on. But anyway, that's it. That's my passion project. I'm
That's
really fond of
amazing.
It's amazing. You're a nurse, a business owner, entrepreneur, advocate, policymaker. A way maker for the wayward. I mean, I just love it. I mean, and that's why you're on Can I Talk with Rod. So
I love you. But God is good, you know. He put it in my heart. And he's helped me to
I think we need to remind people in April, I'm coming right to you. Remind people, and E says this all the time, it's not about getting high. People that you might think that are just like, oh, he just want to get high. They're getting medicated. It is their way of getting medicated to deal with the trauma. PTSD is one of the diagnoses that I think is on everybody's medical program in every single state.
Yes.
As a condition.
Yes.
So just know that PTSD is not only associated with warfare or wartime or war period. There are, and if you've had a moment that is triggered in post-traumatic syndrome, go get your card. If you want to look at another option, or if you consume, get legal, get medicated, get your card. April, talk about your passion project. And I saw the dementia and it just popped out to me. So I don't know if that is or not, but I just saw and it's so important, especially from the dementia angle as well as Alzheimer's, and how that affects definitely even more so communities of color. Those elderly patients we've seen through data have a really, really tough time. But overall, there's a tough time.
Absolutely. I think that you add age to anything and it magnifies the severity of it 100 times. So if you're a person of color and then you have dementia, not only do you have to deal with those issues that Kibra mentioned before, kind of unpacking the myths and the stigma about cannabis, but I honestly have shared those stories anonymously, and those are mainly stories of patients that I've worked with, that I've developed relationships with, and I've seen how effective cannabis can be for not only the dementia, but I mean, it's really the symptoms, the depression and anxiety that comes along with that. It is a very debilitating condition. And, instead of patients taking 5 different pharmaceuticals from it, they can find that this one plant is able to help them with so many things. But so I want to share their stories, and I think that sharing those stories not only increases the awareness among other patients, but it increases the awareness among physicians and nurses in my area.
Yes.
As nurses, we are required to know how to take care of patients who consume medical cannabis, according to the national boards of nursing. But I would, probably guess that, 10 years ago, I certainly did not know how to care for cannabis patients. So I think that, my passion is just getting that information there. Getting that information out there for everyone to hear those stories of how, 5 milligrams of THC a day and some CBD, can really make a big difference for someone.
Absolutely.
And Rod, I remember what you were asking me earlier.
Okay, go for it.
But you were asking me about because of COVID and post-COVID trauma, and yes, that has been. I've seen my business multiply. It probably has doubled since COVID and this pandemic. And so we're not only seeing patients and people who have actually had COVID that are now suffering from trauma, but essential workers, nurses. Like I always say, I've been a nurse forever. I've always worked in the hood. Like I've seen every diagnosis you could possibly see, any infectious disease. I probably encountered it, but this was the first time I was ever afraid as a nurse to go near a patient. And I felt bad. Like I would literally rush in and rush out, do whatever I could as quickly as I could to just get out because I was afraid. And that is something that a lot of healthcare practitioners experience, and it does something to you as a nurse because it's not your nature to,
Nope.
to treat people like that or to feel like that about a person. And so a lot of people have been suffering, and that's why we've included essential workers, people who can get their card for a very significant discount, because the traumas are out of this world right now. They're out of this world right now, and a lot of people are suffering from anxiety. You can't even go get your groceries without being worried about being infected. So, I'm sorry I didn't. It went out my head.
You're fine. You're fine. Listen. Listen, as we get ready to wrap up, we could probably go on. This always happens with Can I Talk with Roz. The conversation is so on point, so good. And even on the policy side. So you guys on the policy side, do you guys support telehealth as a first option of connectivity? Okay, we all do. So lawmakers, we want to see
what has telehealth embedded in it. Like it was a crucial part of this system. Like we want to be able to meet patients where they are, wherever that is.
Yeah. We got to get you down here to Florida and get you connected. As we start to wrap up, guys, and we could go all day long, but words cannot tell you how much I appreciate you. Hold on one second. Let me make sure I don't have any more questions. All right, so we got people saying it was an amazing show. Thank you everybody for joining in with us today. It was definitely amazing
really
show.
Good questions.
And we appreciate you guys so much. As we wrap up and get ready to take it home, please, here's how you guys can make sure that you follow us. But just wrap us up for today and tell us how important today was, man.
I think it speaks right to something you've been saying ever since this whole COVID-19 crisis hit, is that we, I think, have a strong case to go back to our legislators to talk about increasing access to minority communities through social equity programs for medical marijuana programs. I know we see that and we make that connection with the adult use programs, but I think there's a case to be made for increasing that access. I think it's also a case to be made for allowing for home grow and allowing for patients to be able to grow their own medicines, as a way of affordability. But there's so much from a policy standpoint that I think we still have a ways to go on, and I think our conversation today highlighted that. So thank you to our guests, man. You ladies are phenomenal. This is why we could talk for a whole another hour. Because
amazing. And right quick, let me give a shout out to, we got our Virginia chapter president for MMN, Antoine Hines. Shout out to that brother. Shout out to Marnay Madison in Missouri. She's working with April. They're making things happen. And shout out to our newest leader that's going to be taking over Connecticut is Tamika McPhail. Shout out to those people. Just beautiful people that's just ready to work in their communities, and we love you guys. So I couldn't let this go without telling you guys thank you so much. So you got it. I'm going.
Thank you guys again to our audience for continuing to support Can I Talk with Roz, Minorities for Medical Marijuana, and all the work we do. Trust us, we see you. We know you're listening. We know you're following. We get all of the reports and all of the love when we're out in the streets. And so we couldn't do this without you guys. So we thank you. As usual, go home this weekend, love on yourself, take some time for yourself, love on your family. And we got much more work to do next week. So we hit the ground running on Monday. We'll see you guys again next week for another episode of Can I Talk with Roz.
Bye, everybody. Have a great weekend.
Bye.
Thank you, ladies.
Bye. You're welcome. Thank you.